And today we are going to be discussing something that is incredibly relevant to Pakistan's healthcare system, and that is diabetes. So Dr. Atif Munir, you have the floor, and I'll be here for any assistance you may need in the background.
Okay, yes. So thank you, Aisha, and thank you for the invitation. It's always lovely to be among uh, youngsters, which includes myself, obviously, uh, because I've been presenting quite a lot over the years since I've been back in Pakistan, and I've always found young audience more receptive. So, just a few quick checks, and then we start. So, I'm going to be discussing diabetes primarily in context of prevention. And you're the sort of audience who we need to discuss prevention with. Treatment is a different ball game. We're not discussing treatment. We all need to protect ourselves from diabetes, why, how common it is, etc., etc. We'll discuss all that. So, just two requests. One, everyone should keep their mic on mute, please, so that there's no unwanted disturbance from the background. That's a limitation of Zoom that we have. And secondly, any questions, any queries, keep them for the end. Um, I will finish in 35 minutes. We'll have ample time for question and answers. So now just let me put this thing on and share some screen sharing. So just a second. So I should just let me know if you can see the slideshow in slideshow mode. Yep.
That's perfect.
Okay. And let me turn my camera off so everyone is now focused on the content that we have in front of us. And with my limited IT skills, I might just struggle to do that, but let me give it a go. I don't know where it is. Just a second. Here. Yep. Okay, Aisha, we're good to go?
We're good to go. We're perfect.
Brilliant. Okay, so that's me. Aisha's already introduced myself, so let's make a quick start. Okay, so what I'm going to cover over the next 35 minutes. What's the burden of diabetes, especially in our part of the world, especially in Pakistan? Etiology or cause or causes? How can we stay away? So these are sort of things we're going to discuss. And primarily, I'm going to emphasize on how common it is and how we can all prevent it or protect ourselves or stay away from it. So just to go through some statistics, which are pretty scary. These are world's or global statistics, and I'll just whiz through them as a summary. So that's the 3 points to take away. 1 in 10 adults across the world has diabetes. And when you say diabetes, we talk about predominantly type 2 diabetes. So 1 in 10. And as you can see the other statistics around it, you can do the calculations. The health expenditure is a big factor apart from the health consequences of diabetes, and 11.5% of global health expenditure is spent on diabetes, global. And remember, we are a third world poor country, and affording this much burden of diabetes that we have, which we'll go through in a second, is a mayhem for us with our crumbling economy. Okay, so 1 in 10 around the globe. These are even more scary statistics because the prevalence of type 2 diabetes is increasing across the globe at an alarmingly fast pace. So this is global. If we just focus on the right hand side, Southeast Asia, where we come in, it is expected that over the next 20 years, type 2 diabetes will increase by 68%. 68% for a chronic health condition to increase by in a span of 20 years is just overwhelming for any health setup, any health economy, or any nation in general in terms of its fitness, especially for a condition that is preventable. And these are the projections. Again, these are statistics, same ratios and projections as we went through the last slide. Let's skip that. Um, and these are the distribution between urban and rural. So as you can see, urbanization has its consequences, and one of the main health consequences of urbanization is a tremendous increase in the prevalence of type 2 diabetes. The root causes of why, etc., etc., we'll go through in a second. And here we are. So, as a third world country, we do not have much to be proud of. We are number three across the world in terms of health burden or people living with diabetes. So, as you can see, with regards to our population, so just have a look. Top 10 countries with diabetes in adults age 20 to 79 years. And we are at number three after China and after India. And for the population that we have, this is a huge number, huge number. Remember, the projection is an increase by 68% over the next 20 years across Southeast Asia. So just imagine what will happen. If we were to sum it up as per current statistics that we have locally, every fourth Pakistani has type 2 diabetes. So if we don't protect ourselves, if we're not careful, we might be, or me or you might be the next victim of the burden of type 2 diabetes. So it's one in four. And usually when I do these presentations in person, I do request a show of hands for people to raise their hands and say which household has a close relative with type 2 diabetes. And usually 80% of hands go up. So that's pretty evident. Okay, so root cause. Obviously, there are multiple causes for type 2 diabetes, but as per evidence, as per evidence and statistics available today, this is the main risk factor. This is the sole main risk factors. Yes, there are people who will not have this risk factor, but those will be handful, 10-15%. So the 80 to 85% of risk of developing type 2 diabetes comes from being overweight or obese. This is what we're going to focus on. The other risk factors include age. Obviously, as we age, the risk goes up. Family history, genetic factors, yes, an important part. But remember, sedentary lifestyle, dietary factors, hypertension. A female who's at diabetes in pregnancy is high risk of developing type 2 diabetes later on in life. Females or women with polycystic ovarian syndrome are at higher risk. Some medications can cause diabetes. Ethnicity, we being Southeast Asian, genetically we're more prone to develop type 2 diabetes than Caucasians. Dyslipidemia is a risk factor, but please remember, main risk factor which is giving us the highest risk of developing type 2 diabetes is being overweight or obese. Yes, then comes family history and age, but these are non-modifiable risk factors. We can't change our age, we can't change our family history. Obesity and lifestyle is something that we can change, and we'll discuss that in a second. So that's a really important thing that people ask. Well, do we have obesity in Pakistan? Why not? Just I don't have to give you any statistics here. Go on the roads, in your classroom, roam around your college campus, go home, go in the streets, go in the bazaars, and you will see obesity all around you. At present, it's estimated that about one-fourth of Pakistani population is obese, and one-fourth of Pakistani population has type 2 diabetes as well. So no statistics, just roam around, you will see obesity all around you. And it's not a local health problem staring us in the face, it's a global issue. These are the projections for increasing obesity worldwide. So we're not the only one who is being troubled by this. It's a worldwide global phenomenon. And this goes in parallel with the increasing incidence of type 2 diabetes, the prevalence of type 2 diabetes. Okay, so this is a research study. Just ignore the take-home message here is the more overweight, the more obese you are, the higher you are at risk of developing type 2 diabetes. Okay, so this is the bit. A lot of people come into my clinic or our clinics and say, okay, doctor, what's the cause of my obesity? What's the cause of my being over? And we are all Pakistanis. We are all looking for shortcuts. They want us to give them a single cause of them being overweight. Actually, this is not what the evidence says, and this is the ground reality. It's not a single factor. It's a combination of genetic factors, behavior, environment. Behavior is linked to the physical activity bit, environment is linked to eating. Genetics, yes, some people do try a lot to lose weight, but their weight is very stubborn. They have very strong genetic factors. So, but genetic factors is something that we can't control, we can't change. But have a look at the other two circles. Behavior environment is something that we can change. The remote control of behavior environment is in our own hands. So at least we can address these two out of the three. Environment. So environment is linked to the portion size. The portion size is not what we eat, it's how much we eat. And I will not bore you here with a lot of data and statistics, etc., etc. Just have a look at this example and you can correlate what's going on with regards to how much we eat and what has changed in that regard over the years. So just compare. On the top, we have a Burger King burger. The size of this burger in 1954 was this much, and it had 202 calories. 2004, the size of the burger has increased enormously. It's almost double the size. It has almost double the calories. This was 2004. The sort of and the size of burgers we have these days are like two-story, three-story burgers, and just multiply the calories. And you will know what we mean by portion sizes. We eat more. We eat more than our previous generation. Previous generation, the type 2 diabetes incidence or prevalence was pretty less than what we have today. And that's one of the reasons. We eat more. Have a look on the bottom side of the slide. A McDonald's fries thingy was 2.4 ounces, 210 calories in 1955, 2004. The size has gone up, hence the calories have gone up. And 2024, you know the size better than I do. We are eating more, more, and more, and burning less, which we'll come to in a second. So that this is environment, this is portion size. We eat a lot. And obviously, if you eat a lot, you put on more weight. We not only eat a lot, we eat the wrong sort of food as well. Um, anyway, so they are not forbidden, but the how common this practice is of having, I wouldn't call it junk food, I would call it leisure pleasure food, but you can't have leisure pleasure food every single day or every other day. It's kind of a treat, and a treat is it has to be used now and then, not regularly. Go look around you, go through the drive-throughs, etc., etc. They're all full. The first thing you're going to get asked at the till when you order is, "Sir, can I upsize your meal?" They will not let you go until they keep asking you and you say, "Oh, okay, bhai, kar do, upsize kar do." So the size that we are having, the upsize is a cherry on the cake. Calorie content goes up further. I will not bore you with any evidence. I've been asked to do many presentations on food and diet as an endocrinologist. What should we eat? Get the doctors to train other doctors and tell their patients what to should eat. What does the evidence say? What does this say? And I have been kind of like scratching my head, going through all the evidence and presenting research or this research, the 5-2 diet, the keto diet, the this diet, the that diet. And I was like, well, no one's acting on it, so why should I spend so much time in digging out all these evidence of calorie restriction, 5-2, and keto? So then I found this. Well, we are Muslims, albeit so-called, but this is what the Prophet said ages ago. I read it out. So the Prophet said, the son of Adam cannot fill a vessel worse than his stomach, as it is enough for him to take a few bites to straighten his back. If he cannot do it, then he may fill it with third of his food, third of his drink, and third of his breath. So eat to live, not live to eat. Then this is the gist of the evidence behind portion control. The whole idea of current research of losing weight, putting your diabetes into remission if you have diabetes, or staying away from diabetes is revolving around this principle. Take calorie restriction, take keto diet, take the 5-2 diet, take the intermittent fasting, whatever. This is the principle. So the Caucasians are using this principle, which should be our principle, and telling us and the world, you lose weight, you eat less, and you stay away from diabetes, or your diabetes goes into remission. But we are not following this principle that has been told to us ages ago. So no evidence. This is your evidence. Follow it if you want to lose weight, maintain a healthy weight, stay away from diabetes, etc. Okay, so behavior. Under the umbrella of behavior comes physical activity. Remember, behavior is the second pillar of cause of being overweight or obesity. So it's genetics, behavior, and portion sizes. So behavior, the umbrella of behavior, it covers physical activity. And I think I don't need to show you any slides or anything. We need to self-reflect how active we are as an individual in our daily lives. By active, I mean physical activity. This is our favorite physical activity these days. I love this slide. I like to mix up my exercise routine. Sometimes I right click, sometimes I double click. And this is all we do mostly. So we need to all reflect how active we are in everyday life. Activity doesn't have to be 20-minute walk. Well, if it can be, it's brilliant. It can be going to a gym or cycling or swimming. That's much better even. But small things around you can be done. You have a huge medical college campus. Just 2 rounds around the campus should be enough. You would probably have flight of stairs in the main building. Don't take the lift, take the stairs. It is so disappointing that when I go for my lecture, medical students are all lined up outside the lift with their mobiles on their WhatsApp because it's a long queue. The stairs are always empty. Virtually no one is taking the stairs, just a few flight of stairs, and everyone is waiting outside the lift. So small things around you can be a starting point rather than a gym or walk or jog. If you can do that, absolutely brilliant. But please, the longest journey starts with a single step. Okay, so I was asked to deliver the same presentation few weeks ago by quite a busy hospital in Lahore. Okay, so as I was entering this hospital to go to the auditorium, set my things up, deliver the presentation, this is the main entrance of the hospital. It's the hospital is very busy, but it's in a very congested place of Lahore. This is the main hospital entrance, the only entrance this hospital has. This guy, whoever he was, well, I've kind of intentionally blue painted the number plate so that's not it. I don't know whose car was, but I didn't want to disclose the identity. Anyway, so this guy has parked his car right in front of the stairs of the hospital, which is the single entry of the hospital. Patients, relatives, etc., etc., staff, they all have to go through these stairs. This guy was not bothered. The emergency entrance is separate, so this was not an emergency, I'm sure. This guy has parked his car right in front of the stairs, probably because he was too lazy and too crazy to just walk a few steps and enter the hospital. And that's the national attitude we have towards walk and exercise. So I took this picture. I took 5 minutes to put this picture into my presentation and show these hospital guys that this is how lazy we are as a nation. This guy is parked right there, irrespective of the regard for others who have to use this entrance, but he's blocked the way because he was lazy and didn't want to walk even a few steps. Okay, so what we need to do, we all know what we need to do, but just recap. It's good to reflect, recap, lifestyle changes. It's all about a healthy, active lifestyle. Nothing can happen without motivation. There are no injections available for motivation. There are no pills available for motivation. It has to come from within. Yep. Set a target. a first target can be 5% weight loss. Where does 5% come from? It's not me devising 5% weight loss. And mind you, it's 5%, not 5 kilograms, please. All of us, whatever we weigh, if we lose 5% of our body weights, evidence tells us it can protect us from diabetes, blood pressure, cholesterol problem, etc., etc. You want to lose more? Brilliant. The more, the better. Don't worry about your relatives telling you, oh, you're going so weak. Oh, what happened to you? Are you ill? 5% weight loss and maintain it or try to maintain it. That's the starting point. More the better. Obviously, we all know we're all medical students, we're all doctors, balanced diet, calorie restriction, high glycemic. It's not the fact that you can't have this fast food at all. It's about moderation, the frequency, the quantities, etc., etc. No food is out of bounds. It's all about self-control. And remember, please, the remote control of self-control is only in your own hands. No dietitian, no rishtedar, etc., etc., can guide you, or they may be able to guide you for a few days, but you have to take control. We all have to. Top tips for healthy eating. We all know that. I won't go into this. Fruits, vegetables, 5 a day, fish, etc., etc., etc. Healthy, balanced diet. And remember, please keep the portions as minimum as possible. Remember the hadith I told you. Physical activity. That's what evidence tells us. So if anyone is interested, okay, doc, how much should I exercise every day? That's the standard that evidence tells us. 150 minutes, 2.5 hours a week. Activity can be spread out throughout the day. One way to do your recommended 150 minutes is weekly physical activity, 30 minutes on 5 days a week. We don't stick to principles. So I get a lot of patients in clinic and they say, oh, what time shall we walk? Fajr, nighttime, da 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 da. We get lost into so many minute things that the whole key core message of or the whole principle gets so diluted. When should I walk? What's the best time? Etc. etc. When I was just say, well, just walk, please. Science does not guide you what's the best time. Just do this if you can. Otherwise, please don't get into any details. We get into a lot of details and we get lost in those details because we just don't want to do it. I'll quote a very example here from everyday practice. So I have this middle-aged female who's I think around 48. She's a regular client of mine. I don't call patients. It's bad language in terms of medicine. We should call them clients. So she comes to me fairly regularly. So last time she has suboptimal, well, not that good diabetes control always. And obviously it's not just insulin and tablets that can control diabetes. The main cornerstone of diabetes management is lifestyle changes and weight loss and being active. So she comes to me last year, well, 2 years ago or 2.5 years ago. Okay, your HbA1c or your diabetes is not well controlled. Are you walking? No, 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 no. Can you walk? Yes, yes, yes. So why are you not walking? Oh, doc, COVID is around. I'm not going out of the, well, okay, COVID is around, but put your mask on, walk. What stops you from walking? Oh, she doesn't want to do it. She comes back 6 months later. Okay, are you walking? No. Why are you not walking this time? Because there's a dengue outbreak in Lahore. Okay, so dengue out. Put your mask on, put your sleeve shirt on, go out for a walk. She's just looking for excuses. Dengue, COVID, fine. Stay in your house. Stay obese. I'll increase your pills. I'll increase your insulins. Full stop. What else? Have a look at this slide. If this slide or if this message sounds like you, then may God have mercy on you at this age. Top tips for getting active. Again, no science. Start slow, small changes. The other thing I have noticed here in Pakistan, because we're a very emotional nation. So if anyone wants to start, they go berserk. 45 minutes, 2 kilometers, 3 kilometers. So just like it's a kind of a sprint, and in a month's time, they exhaust their energy and their motivation, and then they stop altogether. Anyway, I don't know. People are different. So whatever, but it's good to go slow, make small changes. Good to get fit with family, friends. So there is some company as well, and an activity that you enjoy. Okay, so another example from everyday life. So Yeah. So I get a lot of children, young children, well, 13, 14, being brought by their parents that they are overweight. Okay. So, and obviously the discussion is around physical activity because we can't prescribe medicines in this age. And because children or parents are now getting concerned, they didn't get concerned while the child was growing obese because obesity does not come overnight. It's there for years and years and piling weight on, piling on. The penny drops when the child, if it's a female, gets period problems or hirsute and then social bullying, etc., etc. The males, for male children, the penny drops. Obviously, the weight is increasing year for years, and the penny drops when these children develop gynecomastia, and then they're bullied. So females are bullied because of their hirsutism, or they get concerned if they have period abnormalities. Males get concerned when they are bullied by their friends for their gynecomastia. So I discuss physical activity and this and that, and then the parents are like, "Shall we buy him a treadmill?" Well, yeah, you can buy him a treadmill only if this child wants to go on a treadmill. He's a child. Ask him what he wants to do. Maybe he wants to play cricket. Maybe he wants to go swimming. Maybe he doesn't want to do anything. In that case, get some motivation injections for him, please. So let the person do, or should the person individual should do what he or she wants to do. Let me tell you something very interesting. And these things happen in everyday life. So I had this family who come to me, husband and wife. They are both overweight. They both have diabetes. Uh, they both don't do anything with their lifestyle in terms of physical activity. They are careful with their diet. And so this time they come and they say, well, we have brought a treadmill for ourselves. Brilliant. But okay, brilliant. In fact, we have brought two treadmills for ourselves. Oh, that's even better. Two. Why two? One for her, one for me. Okay, brilliant. Are you using them? No. So, what do you use them for? What's the point of having two treadmills? Why even one treadmill? You're not going to use it. So, the husband tells me in a very light and dejected manner, Doctor साहब, उर्दू में कहते हैं, डॉक्टर साहब हम वाकई यूज नहीं कर रहे, आई एम बीइंग ऑनेस्ट, हम उसको यूज नहीं कर रहे, हम उस पर सिर्फ अपने ना कपड़े धो के सुखाने के लिए इस्तेमाल कर रहे हैं ट्रेडमिल पे। मैं कि यार ये तो बड़ी एक्सपेंसिव चीज है जिसपे आप कपड़े सुखा रहे हैं, कपड़े तो आप बाहर 200 रुपए की तार लेके भी सुखा सकते हैं। एनीवे, सो द ट्रेडमिल, one of the uses of treadmill is this. You've learned something new today. Goals please set करें, keep it varied. You can change your physical activity. Yes, we are all humans, we can get bored. Don't give up in anything, not just lifestyle changes. Last few slides, I won't bore you with this study, but ignore this slide. This is a Chinese study. I've just quoted one study. This study tells us that the gist or the summary. If you're careful with your lifestyle and if you maintain a healthy body weight as per your age and as per your height, you can stay away from diabetes for up to 20 years. Even if you have lapses of diet and exercise in between, on the whole, if you're being careful, you can delay or prevent diabetes for up to 20 years. Remember, the earlier you get diabetes in your life, the longer you live with diabetes, the chances of getting diabetes related long-term complications go up the longer you live with it. Okay, so I'm going to close in about 6-7 minutes. I'm going to show you two videos. One of the videos, both videos were done by myself and my team through a grant that we got from UK because we wanted to promote healthy living in this country. So I put in my share apart from trying to be healthy myself in terms of lifestyle. We thought we need to do something from the general public as well. Okay, I'm going to show you two videos. Now, the first video is about type 1 diabetes. What we've discussed so far is all type 2 obesity, type 2 diabetes, 1 in 4 in Pakistan, etc. It's all about type 2. The reason I want to show you the type 1 diabetes video as well, because you're all medical students. Please watch out for type 1 diabetes around you. It happens in kids or teenagers. We all know type 1 diabetes is insulin requiring diabetes. It's not obesity related, it's not diet related, not due to the lapses they're not obese. But please just watch out for type 1 diabetes around you. Any relatives, kids, etc., etc., and spread the message. And the first video will be about type 1 diabetes. The next video will be about type 2 diabetes and lifestyle changes. So let's just watch the type 1 video first. Aisha, if there's any problem with the voice or sound, let me know and I can recheck. Here we go.
September 2017 जब उमायमा हमारी ज़िंदगी में फाइनली आई है. उमायमा वाज जस्ट अ बिग चेंज इन आवर लाइफ. फ्यू मंथ्स बैक हम लोग कलाम साइड गए, बट यस जब हम लोग वापस आए हैं तो डायरिया और लूज मोशन हो गए, जो हमें लगा कि शायद दांत निकालने की वजह से होगा. और उसने पानी बहुत पीना शुरू कर दिया, तो लाइक हमने सोचा कि सडनली लाइक वेदर चेंज की वजह से होगा, क्योंकि गर्मियाँ भी स्टार्ट थी. बट देन शी लॉस्ट 4 kgs इन अ वीक एंड स्टार्टेड यूरिनेशन इन एवरी 10 minutes.
टाइप 1 डायबिटीज़ के जो सिम्टम्स हैं उनको बहुत सारे लोग मिस कर जाते हैं, क्योंकि बच्चों में किसी को ख्याल ही नहीं होता कि बच्चों में भी डायबिटीज़ हो सकती है. इन सिम्टम्स में बहुत ज़्यादा फ्रीक्वेंट वॉशरूम जाना, बहुत प्यास लगना, वेट का सडन लॉस, मतलब ये कि बच्चों का वज़न 1 हफ़्ते 2 हफ़्ते के अंदर अंदर जो है कई केजीज़ गिर जाता है, और बहुत थके हुए रहना. ये 4 वो सिम्टम्स हैं जिनकी आगाही हर घर में मौजूद होनी चाहिए, ताकि अगर किसी बच्चे के साथ ऐसे सिम्टम्स आ रहे हों तो वो उसको फौरी तौर पर टेस्ट करवा सकें और उसका टाइमली इलाज शुरू करवा सकें.
किसी ने सोचा भी नहीं था कि 1.5 साल के बच्चे को टाइप 1 डायबिटीज़ भी हो सकता है, जिसकी वजह से हमें इन सब सिम्टम्स को कुछ और ही समझते रहे और लाइक उसका केस इतना ख़राब हो गया. जब उन्होंने हमें ये कहा कि जी आपकी बेटी को टाइप 1 है और वो डीके की कंडीशन है उसकी, बहुत मुश्किल वक्त था हम लोगों के लिए. और उमायमा के शुगर लेवल्स कंट्रोल में नहीं थे, विच इज़ अबव 1200. जब उमायमा डायग्नोज होके हीलिंग की तरफ आई है तो डॉक्टर्स ने मुझे बहुत एक स्ट्रिक्ट डाइट प्लान फॉलो करने के लिए कहा. बट ये इतनी सारी कन्फ्यूजन, एक क्वेश्चन मार्क कि वो एक ग्रोइंग एज की बच्ची, शी इज़ ओनली 18 months ओल्ड, मैं उसके लिए ये चीज़ें कैसे रोक सकती हूँ. स्पैगेटीज़ नहीं खानी?
हाँ जी खानी है.
स्पैगेटीज़ बनाई है आज मामा ने. ये वक्त था जब मीठी ज़िंदगी मेरी लाइफ में आई और उन लोगों ने मुझे सिखाया बेसिकली कि अगर डायबिटीज़ आपकी लाइफ में कनेक्ट हो भी गई है तो इट्स नॉट द डिफ़िकल्ट टास्क, यू हैव टू मैनेज इट एंड इट्स वेरी इजी.
पेरेंट्स होते हैं, उनको ज़रूरत होती है सीखने की. फॉर एग्जांपल कि डायबिटीज़ के साथ आपने स्कूल किस तरह जाना है, आपने काम किस तरह करना है, आपने खेलना किस तरीके से है. सो ये तमाम बातें हमारी जो पेयर सपोर्ट है, जो हम लोग एक दूसरे के साथ दोस्ती करके एक दूसरे का सहारा बनते हैं, उसका हिस्सा है.
पंक्चर. शिप.
Strip. What is this? Meter.
मीटर.
Meter.
Ready?
1,
2,
2, 3. लग गया.
कभी भी डर नहीं होता. Can
We
we
get
get
a
a
pet.
pet?
Say hooray!
ये मुझे पढ़ाई.
अगर आपको टाइप 1 डायबिटीज़ है तो प्लीज़ ये मत सोचिए कि ये आपने मांग के नहीं ली है, ये हो गई है. आप इसके साथ एक बिल्कुल अच्छी नॉर्मल सेहतमंद ज़िंदगी गुजार सकते हैं और लोग गुजार रहे हैं. शर्त सिर्फ ये है कि अपना और अपनी सेहत का ख्याल रखें, अपनी इंसुलिन टाइम पे लें, अपनी डोज़ की जो एडजस्टमेंट है वो अपने डॉक्टर के साथ राब्ते में रहकर करवाएं, अपने ब्लड टेस्ट टाइम पे करवाएं, एंड दैट इज़ इट. आप इस टाइप 1 डायबिटीज़ के साथ क्रिकेट भी खेल सकते हैं, आप इस टाइप 1 डायबिटीज़ के साथ जहाज़ भी उड़ा सकते हैं, आप इसके साथ इंजीनियर भी बन सकते हैं, आप इसके साथ डॉक्टर भी बन सकते हैं. और हमारे पास इस तरह के बहुत सारे लोग मौजूद हैं जो टाइप 1 डायबिटीज़ के साथ कामयाब प्रोफेशनल पर्सनल ज़िंदगी गुजार रहे हैं.
Okay, so as I said, the last video, I think it's a 3-minute video, and then I will shut up and we will open the floor for questions, queries, comments. So let's just watch this. This is a type 2 prevention kind of awareness video.
आज दुनिया में तकरीबन 400 मिलियन लोग शुगर के साथ ज़िंदगी गुजार रहे हैं। पाकिस्तान में हर 5वें शख्स को शुगर है। अगर शुगर के साथ ज़िंदगी गुजारने वालों की तादाद में इसी तरह इजाफा होता रहा तो आने वाले वक्त में हम में से बहुत सारे लोग इसमें मुब्तला हो सकते हैं। इसकी बुनियादी वजह दुनिया का बदलता हुआ तर्ज ज़िंदगी है। अपने इर्द गिर्द नज़र दौड़ाएं तो खेल कूद के मैदान खाली और रेस्टोरेंट्स भरे हुए नजर आएंगे। हमें मालूम है कि शुगर की पेचीदगियां बेशुमार हैं, लेकिन इनसे बचाव भी सिर्फ 2 अल्फाज पर मुश्तमिल है, नज़्म और ज़ब्त। नज़्म और ज़ब्त का मतलब है सेहतमंद तर्ज ज़िंदगी। ये सबके लिए अच्छा है, चाहे उसे शुगर हो या नहीं।
सेहतमंद तर्ज ज़िंदगी के बावजूद भी आपको शुगर हो सकती है, लेकिन सेहतमंद तर्ज ज़िंदगी आपके शुगर लेवल्स को कंट्रोल रखने में मददगार साबित होता है।
अपना वज़न एक मुनासिब हद में रख के हम अपने आप को ना सिर्फ शुगर बल्कि सेहत से मुतालिक कई और मसाइल से महफूज रख सकते हैं। मैं हफ्ते के 5 दिन आधा घंटा सैर या वर्जिश ज़रूर करती हूँ ताकि मेरा वज़न मुनासिब हद में रहे।
मुतवाज़िन ग़िज़ा आपको सेहतमंद रखने और आपके वज़न को मुनासिब हद में रखने के लिए बहुत अहम है। मैं अपने रोज़मर्रा के खानों में सेहत बख्श खानों का इस्तेमाल करती हूँ और मीठी और तली हुई अशिया का इस्तेमाल बहुत कम करती हूँ।
मुस्बत सोच जिस्मानी और ज़हनी सेहत के लिए बहुत ज़रूरी है। मैं अपनी हर सुबह का आगाज़ मुस्बत सोच से करती हूँ।
सेहतमंद तर्ज ज़िंदगी अपनाइए। सेहतमंद पाकिस्तानी से है सेहतमंद पाकिस्तान।
Okay, so let me just close this. We are all done. Stop sharing. Video on. Yeah, floor is open. I think the best way would be to raise your hand and then unmute yourself and put your question. Aisha, does that sound okay?
Yeah, that sounds perfect.
Okay.
Since the floor is open, I think I'm going to begin. Thank you so much, Dr. Atif Munir, for joining us today. It was although you were still giving the presentation, it was so interactive. And thank you so much for including examples of how it is like to deal with patients when it comes to this topic and how they might react, which I think is really insightful for all of us medical students who inshallah when we are going to be interacting with patients and how to go about situations like this and provide effective counseling. So I really appreciate that component of the lecture so far. And so with that, I would really like to open the floor and really urge you guys to ask anything that you might have, any questions, any queries that you might have related to the session. And if not something related to the session, it could be anything related to the pathway when it comes to endocrinology. It can be anything related to the session and sir's professional domain as well. So we would love if we could have this, this atmosphere where, we could learn from one another and other people's questions. So guys, feel free to chime in and ask anything.
I hope they're not all asleep or doing other stuff.
Oh no, actually there is a question in the chat that I will read out. It says,
Okay.
sir, if sugar level is 180 and patient is 2B2,
Type
is it
2.
normal? Oh, okay. Sorry, yeah, type 2. Is it
Okay.
normal after?
Yes, up to 200 is fine, but the targets are very much individualized, so depends on a lot of other things as well. How old is the patient? How fit is the patient? Are there any other medical problems, etc., etc. But on the whole, yeah, 180 is good. Here comes my dreaded question. Can you give a diet plan? Answer is no. It's the principle. Well, diet plan is done by a nutritionist. So the principles are there. We just need to apply the principles. Yes, if there is someone who wants a tailor-made diet plan, that, oh no, I'm sort of a person who we get two types of people in clinic. Mostly people, whether they follow it or not, mostly people want to just discuss the principles of diet, which we've already discussed in the presentation. There is a small group of people that we encounter who want a plan because they think when they have a plan, only then they can stick to following it. In that case, the plan is made by a consultant nutritionist, because having an individualized plan requires a lot of information. What does this person eat? How much does he eat? What is their exercise pattern, and etc. etc. What sort of foods, quantity? So they first do the calorie counting, total calorie counting for that person based on his or her daily routine intakes. Then they devise an individualized plan for that particular person. And honestly, in fairness, in actual practice, people do follow the plan, but a month, 2 months, 3 months. So those plans are pretty strict. And as a human, it's our instinct to sway away from a very strict plan. So, but anyway, there's no right or wrong way. They need to lose weight by hook or by crook. So if they want to follow a plan, yep, a dietitian can, a nutritionist can devise a plan for them. How long they follow it, that's up to them. But the aim is to lose weight. That's it. So if both parents have diabetes, how likely is a patient to develop diabetes? No, it's not inevitable. The risk goes up to about 30-40% if both parents have it. I think it's 30, something like that. But the other 50-60% is still in your hand with your lifestyle. So that 60% is still pretty much in your control. What if maternal relatives have diabetes and grandmother, brothers have diabetes, and her mother will affect us? Your risk is no different to the risk of general population, because your parents don't have it. But you just need to be eating healthy, burning your calories, maintaining your weight, or if you're overweight, losing your weight. So your risk is no different to anyone else around you. Stress affect diabetes. Stress as a cause for diabetes is not well proven. Limited data, but stress can aggravate diabetes in people who have diabetes. That's proven. Any other questions?
If anyone has any feedback or any comments they would like to make about the session, that would be welcome as well, before we move towards concluding the session.
Okay, thank you so much, Dr. Atif Munir, for the sparing times of some moments for us from your precious time. If anyone wanna ask questions regarding diabetes, he or she can contact us. We will convey your message to the Dr. Atif Munir. And thank you everyone for joining. From Umar Betty as the General Secretary of the AMSA-Pakistan. Thanks.
So Aisha, we're good to leave.